Hospital nursing or home care? I don't know about you, but being able to go to Dunkin' Donuts and play cards whenever I want during my shift seems like a pretty good deal. One huge advantage to home care is that you have so much freedom and flexibility with your schedule. Well, most of the time. If you want a fast-paced day or a slow-paced day, you can decide which pace you want. Again, most of the time. If you really want to, you can start your shift whenever you want. No longer are you bound by hospital hours to waking up at 5 o'clock in the morning just to barely make it in time to clock in 15 minutes before your shift. In home care, you are in control. If you're an early bird, you can go ahead and start up early just as those jailed hospital nurses do. Or you can sleep in till 10 a.m., eat some breakfast at IHOP or something, and start your day at noon if you really want to. And the freedom gets even better. You're not confined to a 30-minute hospital lunch break. With home care, you can take a break as long as you want to go shopping, dine in, watch a movie, or you can actually play cards. The catch to this freedom is that you have to finish your patient assignment, and unfortunately, that's another story, which leads me into patient load. While a home care nurse may see up to 9 to 10 patients a day, and that's a rare bad day, typically we see around 5 to 7 patients a day. The best thing about patient load in home care is that you're not taking care of 2 to 30 patients all at once, like in a hospital or worse, a nursing home. In a hospital, you're literally bouncing off the walls trying to take care of all your patient at once without breaking down in a corner crying, thinking about why you chose to drown in student debt just to wipe poop. With home care, one of the biggest advantages is that you actually can take your time and really focus on one patient at a time. You can spend your time getting to know a patient, not just health-wise, but life-wise. So much so that you actually become their family. There are actually patients who I've made a bond with, and I can literally show up at their door anytime and they would welcome me in. And of course there are very few that if I show up at their door, they'll punch my face right in, but that's another story. Expanding on this, in the first months working in home care, I was literally shocked with how many gifts, food, candy, and especially water I have received and been offered by my patients and their families. In the hospital, it was literally me sprinting back and forth to fetch water pitchers, ice, juice, sandwiches, and all this stuff to my patients while needing to give my 10 a.m. meds at 12 noon because I had 2 codes in less than an hour. Never going back to the hospital bedside again. So with home care, I do notice that nurses tend to be treated kind of like humans as opposed to slave dog things in the hospital. Something that goes along with the freedom and flexibility of home care is that you pretty much are on your own out there. While this may be a good thing in that you aren't directly exposed to office politics, management breathing down your neck, and coworker nonsense, you are alone when you are practicing. At times you do miss the coworker nonsense and working around other people, but sometimes you do run into your coworkers like the therapist, aides, and your fellow nurses, and you can basically do a joint home visit, so it's not like you're always alone out there. The catch is, while you should have your manager and coworkers a phone call away, if you do get stuck on a skill like blood work or a catheter change and you can't do it, you might have to wait quite a while for backup to arrive, essentially losing time for other patients, and you basically look like an idiot in shame. This is why if you're going into home care nursing, you really need to have a strong grasp, or at least be able to learn and be proficient in all nursing skills, and I mean all of them. Home care nurses can do it all in the home, from blood work to PICC line dressing changes, portacath accessing and care, wound vac care, Foley and suprapubic catheter changes, G2 maintenance and care, and just so much more than just, taking vitals. Personally, I found myself being exposed to more skills than I ever would have done in the hospital. One thing that home care nurses, at least in my area, tend not to do is personal care, like bathing, cleaning up patients, wiping poop, changing diapers, and feeding patients. Usually these things are done by the caregiver or private aide in the home, and the rare times I do personal care is as a favor to provide a break for the caregiver, because most of the time the caregiver is a family member who basically is with the patient 24/7, taking care of them 24/7. In the hospital, practically every day you do personal care as a nurse, because 9 times out of 10 your nurse's aide is usually nowhere to be found, and most of the time families want the patient clean ASAP. Another great plus to home care is being able to document anywhere and anytime after you see your patients. While it is best to finish your charting while you're seeing patients in the home, you do have the option to chart wherever and whenever. If you want to go to the beach after your shift and tan up while you chart, that's possible. If you want to play cards after your shift while charting, that's possible. If you want to go to Disney World and have a picture with Mickey Mouse while charting, that's possible. If you want to binge watch Netflix while binge eating ice cream while charting, that's certainly possible. If you want to binge watch Netflix and then chill while charting, I guess you can do that too, I guess. While the dread is the fact that you still have to chart, at least you're not stuck in a MRSA-infested hospital after a grueling slave ship. And if you literally were not able to do any charting during your hospital shift because you had 2 codes, 3 rapid responses, a patient that had a river of diarrhea with a nursing aide nowhere to be found, and a patient that somehow keeps yanking out his NG tube while in bilateral restraints, and you have a shift the next day too, well, Godspeed. One thing that unfortunately is similar between hospital nursing and home care nursing is understaffing. While this is definitely more predominant in the hospital, home care can suffer the same fate. While, of course, home care nurses aren't juggling 11 patients at once, there are times where we have to see up to 9 or 10 patients, and that translates to more than a full day plus any additional charting we have to do after hours. And there are possibilities that management schedules up to 20 home visits for one nurse during the day, thus creating the need for a nurse to triage and call the other patients, which translates to even more work on the nurse. So with all these factors, and this happening on a daily basis for possibly weeks on end until management can get help, it can get pretty stressful for nurses in home care. But of course, that beats drowning nearly every day in the hospital. So those are a couple aspects of home care nursing if you're making the switch over from inpatient nursing. The main reason I made the switch is because I honestly just hated juggling multiple patients at once and not having enough time for each of them. In the hospital, I just felt like a robot trying to process patients out, because apparently that was the ultimate goal for management, and not necessarily getting them better. With home care nursing, I do actually feel like I have the time for my patients, and for the most part, I feel like I have the freedom to really practice how I want to practice to help my patients. So I thank you all for tuning in, and if you enjoyed this video, be sure to like the video, comment, subscribe, share, keep caring, and live free.